So at this time, before we go further, I'd like to have Scott Clardy, our Assistant Director of Public Health and Human Services. I want him to give you an update on our data, as well as talk about some testing events that are coming in the next weeks that are important, and then we'll move forward and start talking about the order.
Thank you, Stephanie. Good morning. Stephanie said I just wanted to give you some updates on current data. So currently we have 108 cases. We've had 108 cases in Boone County. 9 of those are currently active. We have 98 cases that have been released from isolation, and regretfully we have 1 death. We have 1 Boone County person who is currently hospitalized, and since the pandemic began, we've had 8 Boone Counties that were hospitalized. Of those 108 people, 30 were exposed through travel. We've had 43 that were exposed by having contact with a known case. We've had 33 that are community transmission, which are the ones that concern us right now. And then we have 2 that are unknown. We're still doing case investigations on those to determine what the cause was. In addition to those tests and those results, we recently got information made available to us on how many negative tests we've had in Boone County, and so we had 108 positives, and we're being told we have 7,705 tests that have been ran with negative results. Speaking of testing, I want to remind you about a couple of events. We have been doing some outreach testing for the past couple of weeks or so. Today, right now, we have a crew at St. Lucia United Methodist Church who are doing that outreach testing right now. I wanted to tell you about one other event that's going to take place on June 1st and 2nd. There's going to be a testing event at the Hickman High School parking lot. Those 2 days, it'll run from 7 a.m. to 7 p.m. both days. This testing is being organized by the Missouri Department of Health and Senior Services. We're assisting them. From what we understand, it's actually going to be the Missouri National Guard who will be running the testing site. It's my understanding it's going to be a drive-through site. So we're excited about that. The good news about that is the only criteria for being able to take advantage of that is that you have to live in Missouri. So you don't have to live in Boone County to take advantage of that. You just have to live in Missouri. You don't need a doctor's order. You don't have to be symptomatic. So asymptomatic folks can go get tested there also. As I said, the State Health Department is organizing this event, and they told me this morning that they expect to have a press release out later today with more information about that, including how people can register to go be at that testing event. So look for that later today, a press release from the State Health Department.
So a new order has been prepared, and it will take effect at midnight, May 26th. So a few highlights of the new order, a couple things that need explaining. As you know, Governor Parsons' statewide order is in effect until May 31st. And under his order, businesses can operate at 25% occupancy for those with less than 10,000 square feet and 10% occupancy for retail businesses with more than 10,000 square feet. And social distancing is required. So for those retail businesses that fall in that category now, that is more restrictive than what our new order will be. So they will need to follow those guidelines in the governor's order until May 31st. After May 31st, retail businesses will be able to operate at 50% occupancy, still maintaining social distancing. All other businesses and institutions that may have been closed can reopen. Most businesses and institutions open to the public can operate at 50% capacity. 50% of seating capacity in restaurants and bars with the social distancing requirements between groups. Personal care services like hair salons, nail salons, etc. Are limited to 25 people or 50% of their capacity, whichever is less. Large venues, movie theaters, entertainment facilities, and nightclubs can be at 50% capacity or 50 people, whichever is lower. And they need to submit a plan since they've not been open. We want them to submit a plan for approval showing how they can operate safely. Child care, day camps, and other dependent services need to continue to keep stable groups of children together each day, but they can increase their group size to 25. Mass gatherings are increasing to 50 people. Our parks and trails remain open. Playgrounds and spray grounds can reopen now. For sports, non-contact sports and limited contact sports can begin to play. Contact sports, so football, for example, can have non-contact practices where they're spread out. And we've talked with many coaches about this, that can begin that now. Businesses, entities, large venues, and public gatherings can submit an operational plan and a request for us to review and approve a plan that's different from the order if they have unique circumstances. We've been working with lots of businesses over the last few weeks, and they're doing a great job on this.
You've been putting out a news release on a daily basis. Sometimes it'll say that there are new cases, sometimes it'll say there are no new cases. Why isn't there more information in that release? For example, it doesn't even say exactly how many new cases are being reported on that day. It'll give you the number of the total, but it doesn't even say there are 3 or 4 or 1 new case. It doesn't tell us if they're community transmission cases. It doesn't tell us if they're contact cases. It doesn't tell us where you might have been that community transmission had occurred. So that the people who are going for this community testing on June 1st may feel like, yeah, I was there, I should get a test. Why isn't there a whole lot more information being given about the cases as they're coming up?
So are you referring to the daily that comes out from?
The daily news release that comes out
from the city.
That doesn't even say how many new cases were discovered on that particular day.
Yeah, so we can add that. What we have been doing is updating on the website from day to day. If you follow that, you can see how many cases have been added from day to day, and it includes information on mode of transmission, age range, and racial disparities.
We don't get information on the new cases on mode of transmission to tell us what we can tell the community about what is going on.
Okay.
You give us cumulative information, but it's nothing about the new cases that gives people good, new, fresh information about what's going on.
So I would tell you that a lot of times we don't know all that information by that time that press release goes out, because we're still investigating some of those new cases. That's why, like today, I said we have 2 that are unknown, because there's a couple of them that we still need to investigate. So, I mean, we can look at that and be happy to add that information.
Well, you had 9, I want to get my particulars. You've had 12 new cases since we reopened on May 4th. And so, and we haven't heard any particulars about any of those cases, which if you've got 2 you don't know, that means you've got 10 that have occurred that you didn't.
Yeah, I can go back and get that. I can tell you that yesterday, as of yesterday, from May, so yesterday was May 21st. Between May 20th and May 21st, we determined that one of the cases was a contact to a case, one of the cases was community transmission, and one of those was unknown. I'd have to go back and look at the data for all the other days.
So why aren't you telling us where community transmission may have occurred?
Because we don't know. The whole point about community transmission is that we haven't been able to identify where they were exposed, either because they hadn't traveled or they hadn't had contact with any known case. So that's
the person knows where they were, that they were at a grocery store, they were at a convenience store, they were in a hardware store, at a park.
So most of the time, those kinds of exposures are not the types of exposures that would lead to infection. Though you have to be within 6 feet of a person for at least 10 minutes, and depending on the kind of exposure, maybe up to 30 minutes before that would lead to infection. So if we have an area where we believe there was somebody, like you talked about, maybe if there was a theater or a park or something where somebody was in a set location for 10 to 30 minutes, and then we found out they were positive, and we could not identify all their contacts, that person couldn't identify all their contacts, then we would put out a message saying, if you were at this location, at this time, on this day, you need to contact us. And other health departments have done that, where they haven't been able to identify contacts with them.
So you're saying for all 108 cases, that has never, you've never found that to be a situation because you've never told anybody on
That's
any
correct.
case?
That's correct.